Welcome to Protecting Yourself from Disease, a Standard Precautions Review course brought to you by American Way University. Once again, my name is Angie Danielski, and I have developed this course to help you review this important topic. Here is an overview of what the second part of the presentation will cover. First, we will discuss hand hygiene, including the use of hand gel and hand washing. We will then move on to discuss personal protective equipment and infectious materials. Washing your hands with soap and water is a great way to reduce the number of germs on them, but in most cases, using an alcohol-based hand gel is equally as effective. If soap and water are not available, use an alcohol-based hand sanitizer that contains at least a 60% alcohol content. Alcohol-based hand sanitizers can quickly reduce the number of germs on the hands in most cases. However, sanitizers do not eliminate all types of germs. The steps to apply hand gel include applying the gel to the palm of the hand. You should want about a quarter size of gel in the palm of your hand. Then, you should rub your hands together, making sure to coat all surfaces of your hands, including the front and back, and between your fingers. You should be rubbing your hands together for at least 15 seconds or until the hand sanitizer is completely dry. Washing your hands should be done with soap and water. To begin, turn on the faucet and wet your hands with water. Next, apply the soap, ensuring that you have at least a quarter size in the palm of your hand. You should then rub your hands together for at least 15 seconds, making sure that you cover all surfaces of your hands, including the front and back, and between the fingers. Rub your nails against the palm of your hand. Next, you should rinse your hands, remembering to always keep the fingertips pointed down so that the dirty water does not run up your arms. Lastly, you should dry your hands with a paper towel and discard the used paper towel. You should then take a new towel and turn off the faucet. Do not use the same towel that you used to dry your hands to shut off the faucet, because the moist towel will allow germs and bacteria to travel through the towel. In some cases, we cannot simply use hand gel, but we must wash our hands with soap and water. We must wash our hands whenever we are touching food, especially when coming into contact with raw meat. We should also be washing our hands before eating food or assisting residents with eating, when caring for a resident who is sick, when caring for an open wound, after using the restroom or assisting a resident to the restroom, after blowing your nose, coughing, or sneezing, after touching animals or animal waste, after smoking, and after touching the garbage. Personal protective equipment must be provided by your employer to help keep you and your residents safe and help prevent the spread of disease. Some examples include gloves, gowns, masks, and eye protection. Gloves and sometimes masks are worn most often in the assisted living setting. Gowns and eye protection, in addition to caps and booties, are usually seen in the hospital setting. However, there may be some instances where you may need to wear these items. When dealing with any biohazardous material, including any bodily substance, it is important that they have the biohazardous label on them. All containers that have any biohazard or regulated waste in them should be labeled with the biohazardous symbol, as shown here. At any time when a sample is collected, it must have a biohazard symbol on the container or be placed in a bag with the symbol. If the sample must be placed in the refrigerator or freezer, it cannot be placed in the one containing food. Bodily fluids should never be placed in the same refrigerator or freezer as food. The biohazard symbol must also be placed on any container that is used to store, transport, or ship bodily fluids. For instance, if you have a garbage where you dispose of any blood-soaked items, it must contain the biohazard label. However, in this instance, a red bag may be substituted for the label since it has the symbol already printed on the bag. Likewise, with a sharps container, it usually already has a pre-printed biohazardous symbol on the container. There are different categories of infectious materials, including specimens, regulated waste, and sharps. Specimens are any sample of bodily fluid that will be collected and sent to the lab for analysis. This may include blood, urine, or stool. The bodily fluid is usually collected and placed in a specimen container and then placed in a sealable bag containing the biohazard symbol. Regulated waste contains items that have been exposed to infectious material or have them on it. This includes bandages or tissues, contaminated clothing, bedding or towels, and lab waste. These items are usually placed in the red biohazard bags. Lastly, sharps are considered an infectious material such as needles, scalpels, and lancets because they have come into contact with blood or other bodily fluids. These items can be placed into a hard plastic sharps container. Broken glass or mirrors also need to be placed in the sharps container as they have the ability to break the skin and cause contamination. You have reached the end of Part 2 of the American Way University training of Protecting Yourself from Disease, a standard precautions review course.